Hello friends, welcome back. We continue with our study of epidemics and how homeopathy can be used in these circumstances. We have seen a part of this topic in the earlier lesson, and in this lesson we shall be looking at other homeopathic approaches. One approach which we discussed briefly was individualization. Another one that we saw earlier was discovering the genus Epidemicus for that particular epidemic. We shall also be talking a little about isopathy and another brief discussion on combination remedies. Individualization is the very essence of homeopathic practice and by far the most superior ways of dealing in epidemics. However, as we saw earlier, it can be very time consuming and it requires a lot of resources. It is based on the totality of the individual patient. It requires a lengthy interview and it has been used in epidemic situations in Nicaragua and Nepal. It was used in an epidemic of acute diarrhea in children, and they had excellent results across the population over many districts. In Nicaragua, they used 18 remedies, and in Nepal, they were using 14 remedies. When I say 18 and 14, each patient received only one remedy, but they found that as many as 18 or 14 covered the totality in individual patients. So as we mentioned earlier, this is requiring more time. It is time consuming and it is resource intensive because that decision is made at the doctor level. Whereas when we have the genus Epidemicus, it can be just distributed to the masses by paramedics. Genus Epidemicus has got excellent results in the history of homeopathy. It covers the population quickly and few resources are required. People often wonder why we can't use a combination of many remedies just to cover the entire symptom picture of the entire population, something that the genus approach requires. Although it's not strictly according to homeopathic philosophy, you will be happy to note that it has been used with success in a number of cases on a number of occasions. It is very cost effective. It is supported by numerous studies. In fact, there was one dengue epidemic in Pakistan in which they used a combination of 10 remedies and it worked wonderfully. In Pakistan, it was used as a supportive treatment along with paracetamol, which is an allopathic drug. But with paracetamol, the results obtained were far better with combination remedies than they were without. As a matter of fact, this was recommended by the World Health Organization also. Another approach which we said in the beginning is isopathy. Isopathy is somewhat akin to vaccination. Remedies are prepared from tissues, which may be normal tissues or diseased tissues. When a remedy is prepared by potentizing and serially diluting the product of disease, that particular remedy comes from the class of remedies known as nosodes. They use the infected tissue. Later in the course, you will find many applications of this. But for now, for the brief introduction, we shall just confine ourselves of nosodes being used in what we call isopathy. They could also be using remedies which are known as sarcodes. Sarcodes are remedies which are prepared from healthy organs either of humans or of animals. One very popular remedy in Europe during the flu season is the oscillococcinum. Oscillococcinum is prepared from the heart and liver of healthy ducks. More of that later in the course as we progress. Another very famous application was the use of a remedy prepared from mustard gas, which was helping those soldiers who were accidentally exposed to mustard gas in chemical warfare. Another very great example is of the remedy called leptospira, which was developed from the disease products of leptospirosis, a bacterial disease which was very severe in the year 2000 in Cuba. And this particular remedy had very wonderful results and saved a lot of lives at the community level. You can find references to this in the link provided below. That brings us to the end of this lesson. Thank you very much for your attention, and we'll meet once again in the next lesson. And until then, thank you and bye-bye.